how have you been feeling lately? Maybe your sleeping habits have changed, or maybe you're feeling more anxious and stressed than usual. If so, you're not alone. The COVID-19 pandemic has been stressful for a lot of people for many different reasons. A new Ipsos poll asked over 16,000 people from 16 different countries how COVID-19 has affected them. In Canada, 29% of the adults polled said they're overeating, 30% feel anxious, and 17% are dealing with insomnia. And one way people may be dealing with all of this stress is by finding diversions.
Just like what sort of how anything can sort of throw us off and change how we're functioning day to day, you find that with things like pandemics or war or different just sudden like catastrophic events, people are sort of left in sometimes spinning. They're not really sure how to react.
Raymond says the feeling of uncertainty is also compounded by the number of unknowns when it comes to the virus, as well as feeling overloaded with information.
You know, we get the federal updates, the provincial updates, the municipal updates. We're getting text messages. We're getting bombarded with so much information that it's overwhelming, and it's natural for your body to want some time to do something else, to do something that is more just, enjoyable.
When the body is shocked suddenly or abruptly, there is a rapid rise in body defense processes. This is normal. This is a normal kind of protective mechanism. The body is kind of accustomed to doing this. What can be problematic, though, is if the body remains in this aroused state for an extended period of time. For many, this pandemic has been like that.
Dr. Akiton says ongoing stress not only has an effect on the mind, it also takes a toll on the body.
And sometimes this can have devastating effects. Blood pressure control may be lost. Sometimes elevated levels of cholesterol, abnormal levels of sugar, lower ability to fight off infections and inflammation. So you can have kind of a cascading or a domino effect on your health.
And one of the ways people are coping with this stress is by seeking distractions.
Distraction is a huge thing that a lot of people are sort of defaulting to, both positive and maybe the not so great sort of sources of distraction. We're seeing a lot of people starting to pick up hobbies that maybe they used to have, or start doing new things like learning a language, taking a course, connecting to friends they may have lost touch with.
There are also not so healthy distractions, such as drinking or the use of recreational drugs.
It can be very helpful to have distractions, but it's always sort of like weighing, is this distraction, am I sort of avoiding dealing with things that I need to address related to what's happening? Or do I just need a little bit of a break for myself in order to sort of, again, like collect myself and stabilize myself throughout the day?
It's also important to realize that certain communities, specifically communities of color, have extra barriers to face during this pandemic.
You have a group of people who already have social factors that make them vulnerable. And then you have this same group of people that have medical factors that make them more vulnerable to the illness and the worst outcomes of the illness.
They may not have the physical space in their living environment, or they may just have too many people in their living environment to do some of these like self-soothing and self-care strategies.
The pre-existing medical conditions that are associated with the worst experience of the COVID infection, including the worst outcome of death, are things that are also disproportionately impacting racialized groups.
I think it's important to sort of realize what the different needs of different populations are, so that even while COVID-19 is happening and it looks like it's going to stick around, that we can better take care of our populations.
So the pandemic has been stressful for many people for different reasons. And both Raymond and Dr. Akiton say it's okay to feel how you're feeling.
People cope with the best of the skills and the knowledge that they have. They are truly doing the best they can in these circumstances. It is okay to not be okay. It is fine to not be fine. And it is perfectly normal to not feel perfectly normal.
Thanks for watching. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel where we also dig into big issues around the world in our weekly series, Global News Explains.